Hello. A 25-year-old lady presented to your A&E after unprotected sexual intercourse. Please take history from the patient and answer her questions and concerns appropriately and give the management plan. So this is a sexual history. My name is Hassan Abdurrahman. I am one of the FRCEM Course Academy co-founder and instructor, and hopefully you're doing well. Today's topic, we are going to talk about sexual history in details, a very common station coming in the OSCE exam repetitively. And today we're going to cover all the aspects related to the sexual history. Sexual history in OSCE exam can present in one of three ways: direct question to take history from a patient came to your emergency department after unprotected sexual intercourse, and the patient is having a specific concern. And the concerns usually either patient afraid to get pregnant, or the concern is sexually transmitted disease. So this is the first one, which is direct. The other type might be just like a formal usual history station with abdominal pain or fever or rash, and you start to take your history station, and while you are doing so, you discover that there is a vaginal or urethral discharge and signs and symptoms of sexually transmitted disease. So now the station is turned to be sexual history. The third one, this is a young lady underage, for example, 15-year-old, requiring morning after pills. So in this record, I'm just going to cover the first and second type of sexual history. The third one, the young lady requiring morning after pills, will be covered in separated record, because we're going to talk in details regarding this type of history. So let's start. We agreed that the history station divided into three components: into the introduction, task, and closure. The introduction, this is the first things which need to be done at the beginning of your station, after you read your task outside and you had your 1 minute, you arrange your thoughts, and then you came inside your station, you start doing the introduction part, including greeting the examiner, introducing yourself, confirming patient identity, and so on. For example, if the station from the beginning, it is clear that it is a history or sexual history from the beginning, it is clear for you, we need to add another introduction which is related to the sexual history. After finishing the formal introduction, we need to add additional introduction related to the sexual history. Why? Because in this station, we are going to ask sensitive questions. And those questions might seem personal. And we need our patient to be confident enough to share all the answers with us. So after the formal introduction, make sure that you mention to the patient that we are going to invite you to the private, calm area, so we have a discussion regarding your presentation. One nurse chaperone will be with you, and I'm going to ask you several questions. Those questions might seem personal. Please feel free to answer my questions, and I want to reassure you that all this information will be dealt with confidentiality, dignity, and secrecy, and no one will have an access to those information unless with your permission. So feel free to answer my questions. So this introduction is very important. Why? As we mentioned, so we need to make our patient comfortable to share all the information with us. And you can add another statement that the nurse with you will maintain the same confidentiality and dignity. Because if you didn't make this introduction clearly at the beginning, you might face a situation for which you start to ask questions to the patient and the patient is not answering you in the station. You ask the question, there is no answer. You repeat the question again, still there is no answer. Meaning that your formal introduction or the additional introduction wasn't done or wasn't done appropriately. So the patient is not comfortable to share the information with you. So here you have to make sure that you have a good rapport with your patient. So this in case that the station from the beginning, it is clear that patient came after intercourse with a specific concern. What if our station was just like a formal abdominal pain and we start to take history and we discover that the patient is having discharge and there is sexually transmitted disease? Once you discover that, at that moment, you can just again mention the additional introduction which we just spoke about. Once you discovered, immediately turn your station to be sexual and give this introduction and continue your station. So this with regard to the introduction. Now let's come to the task. The task will be divided into 3 components. We're going to ask, or we're going to divide the task into patient, intercourse, and partner. There are several questions in each section need to be covered. So we'll start by the patient, himself or herself. What we are going to ask them: do you have any past history of sexually transmitted disease? If your patient is a female, ask about the last menstrual period and ask her job and occupations. And is there any chance that he or she engaging in a sex working types of work? This is a very sensitive question. Although we had the initial introduction at the beginning that we are going to ask sensitive question, but I recommend this question should be preceded with apology. Or you can ask that some people, they have a sex like a job. Is this apply to you? I'm really sorry for this question. And we need to ask about the number of partners recently and over the last couple of months or the last 3 months. How many partners does she has or she had over the last couple of months or recently? So those are the questions related to the patient, the past medical history of sexually transmitted disease, her last menstrual period, and engagement of any sex work, and the number of partners. Now, let's talk about the intercourse. What are the questions related to the intercourse? The first question will be when. Timing. Timing is very important because based on that, we can decide many things. For example, if our patient required morning after pills, or our patient required any medications to prevent her from getting pregnant, or there is a consideration of post-exposure prophylaxis. So in the intercourse, the first question will be when the intercourse took place. And the second question, is it consensual? Consensual meaning that the intercourse took place with the agreement of both parties. Third question, was the intercourse under the influence of alcohol? Why this question is important? Because sometimes patient might be intoxicated with alcohol and the intercourse took place against the patient will. So here it will be there is a consideration of rape. And question number 4, we need to ask about the type of the intercourse. Was it vaginal, oral, anal, or mixed of those? And we need to ask about the methods of protection. And the last thing, we need to ask about the methods of ejaculation. Methods of protection, we need to ask if there is any barrier or using of condom, for example, or any pills have been used before the intercourse, and the methods of ejaculation. So those are questions related to the intercourse. Timing, consensual, under influence of alcohol, the type of intercourse, the methods of protection, and the methods of ejaculation. And the last part in the task, which is a partner, we need to ask several questions with relation to the partner, his age, and his country of origin. Is he migrant? Is he local? Did the partner came from the country with high prevalence of HIV or sexually transmitted disease? This increase the risk of transmission of the illnesses and also give us a consideration of the post-exposure prophylaxis. Is the partner complained of any history or of sexually transmitted disease before? And his job and occupation, and is there any chance that he is engaging in a sex working job? So age, country of origin, history of sexually transmitted disease, and job and occupation. Those are the questions related to the partner. And now we should come to the last part in the history, which is the closure. The good news that the introduction and the closure are the same in all the history stations. So in the closure part, we are going to talk about the past medical history, past surgical history, medication and allergies, social history, family history, ideas, concern, and expectation. In the concern here, we need to make sure that we understand clearly the concern of the patient, because we need to address the concern clearly for the patient in the management plan. And now we should talk about the management plan. The first step in the management plan that you have to assess the risk for HIV and the consideration of post-exposure prophylaxis. What are the indications of post-exposure prophylaxis? The indication of PEP after unprotected sexual intercourse that the partner is known to have an HIV or highly likely to have an HIV, like patient came from the area with high prevalence of HIV, or there is multiple assailant, or there is possibility of rape. So those raise the possibility of HIV, for which we need to consider the post-exposure prophylaxis. If there is no indication, do not prescribe. If there is a clear indication, go for that. But if the patient mentioned that this intercourse took place with my regular formal partner and he's locally from here, we just forget to take the precautions and the protection before the intercourse. So in this situation, definitely there is no any clear indication for post-exposure prophylaxis, and do not consider it in this situation. What if it was not clear for you that PEEP is indicated? You are in the gray zone and you cannot make a decision. So here, remember that always there is a microbiology consultant and infectious disease consultant on call, for which you can go back and call them and discuss the case with them, and they can give you an idea about that. If you are in the gray zone, just mention to your patient that we're going to consult our consultant microbiology on call so we can make a decision about the consideration of PEEP. But if it is clear, no indication, do not prescribe. If there is a clear indication, go for it. And also we have to prescribe to the patient medication which can prevent her from getting pregnant if she came within the optimal window. And for example, if the patient already had intercourse, for example, 5 days ago, came with abdominal pain or rash, and there is a vaginal swab, vaginal discharge already there, and patient is having established signs and symptoms of infection. So here in this situation, the management plan will be that we are going to take a vaginal swab or urethral swab, and then we're going to refer the patient to the GAM clinic, which is gastro or which is genitourinary medical clinic, for continuation of the treatment. This is in case if we face in this OSCE station that there is already established infection, and our plan will be swab from the area and referral to the GAM clinic plus prescription of antibiotic. And lastly, we need to provide the patient with the advice. Those patients need advice. What sort of advice? They should follow up with their GP if they develop any lower abdominal pain or any vaginal discharge or any temperature, if they came immediately after the intercourse and there is no signs of established infection. And also, they should come back to A&E or to attend the GP clinic if the menstrual period became late by 7 to 10 days. So at that, there is a possibility of pregnancy. They should have a pregnancy test. And also, we can offer them consideration of long-term contraception methods if they are okay with that. And we need to provide them with advice that if they have a formal partner, they should take a barrier, sexual barrier, during the intercourse, and they should not donate their blood if there is a possibility of infection unless or until they have a full clearance by the genitourinary medical clinic. And lastly, we need to inform them that if their partner start to have symptoms of infection, they should come as well for screening and to provide them with the medical treatment. So this is the approach for the sexual history. The task we divided into the patient, into the intercourse, and into the partner. And you can start with either one. Just make sure that, for example, if you start with the partner, you ask all the questions related to the partner, and then when you move to the intercourse, you ask all the questions regarding the intercourse together. Avoid jumping, because it will look disorganized if you start to jump, and it will give bad impression to the examiner, and it will be much more difficult for you to finish all the questions needed. Here, I advise you just try to gain and maintain the rapport with your patient all the time. Be nice, have a good communication with your patient, and try to not be judgmental. Like this, we cover all the aspects with relation to the sexual history. Hopefully, you found it useful. And that's it. And wishing to talk to you in our upcoming record. Until that time, stay well and speak to you soon.